Hey, this is Doug Fields, CEO of the Institute for Healthcare Consumerism, joined by my co-host Brent Macy, Managing Director, and welcome back to this segment of Healthcare Consumerism Radio. We're pleased today to have one member of our legal leaders with the IHC, and a longtime friend of the Institute, John Kaegi, Chief Strategist with Healthstat. John, good morning.
Good morning. How are you guys today?
Doing fine. Are you out in Washington today?
I'm actually in Oregon today.
Oregon Day. Yeah. I knew you were out there somewhere. John, great to have you on the program. Give our audience a brief background on Healthstat, and then we'll get into the connection here with exchanges.
Well, sure. Healthstat is about a 10-year-old company that is involved in creating on-site healthcare and health promotion. We partner with an exclusive arrangement with ProChange Behavior Systems to provide the best quality possible health behavior change, while we're also providing urgent care type primary care on site for employers.
You know, John, I don't know whether you were able to listen to the previous segments, but in the conversation we had today with the various exchange players, and we have continually in the exchange space, there's always a pause around the health management and health promotion piece. And I think most people will say that at first place there was concern that health management, health promotion would be disconnected and may fall away. But it's quite the opposite, is it not? I mean, you're pretty bullish on where you see the space.
I'm very bullish on it. Actually, it was almost a year ago that I predicted that almost all, if not all, self-insured large employers would go to private exchanges eventually. And one of the reasons is because it offers them the opportunity to bundle in to their plans the kinds of health promotion and incentives that will improve their employees' health, which alternatively improves their productivity, and obviously then reduces downstream healthcare costs. So the private exchanges offer a kind of a one-time administrative cost benefit and a long-term lower cost due to the competition on the exchange by the various insurers, and employers can then reinvest those savings into the kinds of health promotion that will ultimately lower their healthcare costs.
John, when you look at your solutions specifically to private exchanges, what is the thing that the employer really needs to know about your products and where your connection is to that exchange?
Well, right now we're not officially or formally connected to exchanges. Right. We think there's a wonderful opportunity to do so, particularly for our model, because our model is more than just on-site healthcare, which in and of itself is a great value for employers and always provides an ROI. But the real benefit of the Healthstat approach is the health promotion that we provide, as I mentioned, through our partnership with ProChange, which allows our clinicians to use the best-in-class health behavior change techniques that ProChange has pioneered. And so our clinicians have access to information not only about the risks, the health risks of the employees that they're working with, but also about the readiness to change stage that those employees are in. And combining that with the risks allows us to customize the health behavior changes that are necessary for each employee. Now, the great opportunity here is, and we're very excited about this, is that as employers move to a defined contribution approach on the healthcare exchanges, away from single carriers, but more toward choice for their employees, that they're going to have the additional resources available now to invest in an on-site health promotion solution like ours, or any other kind of wellness program that will not only help them lower their downstream risk of cost increases, but also improve the productivity of their employees, and also improve the morale of their employees, because all the changes that are occurring in healthcare are somewhat intimidating to people, and having a stronger, very highly desirable on-site healthcare solution helps to compensate for that anxiety that they feel.
Yeah, that makes a lot of sense, John. And also, as we've got more integrated engagement and communications and education, you're right at the center of that with what you're doing with your solution. So you marry well with what the exchanges are going to be doing to try to make sure they keep that consumer population engaged with them.
But I think what Doug, what he's talking about with with his connection, the health promotion piece to the exchanges, definitely a very good connection there with the private exchanges. What decisions will employers have to make about health benefit options available on those private exchanges, and what can they do with those decisions, and what are the best decisions that they're able to make?
Yeah, I agree, and I think the health and productivity side. All three of our guests have talked about that. Even though that's John's sweet spot, all three have talked about the importance of that, the health management and health productivity piece.
Yeah, and I think when we had mentioned before on the program that we actually had the pleasure to go listen to some of these exchanges in a conference, and what they really talked about is health and wellness and promotion is a very big piece of all these platforms. Picking up on your last point, I think one of the things that Doug and I were talking about are the decisions that the employers are going to have to make about the health benefit options available on these exchanges. What kind of elaborate on that? What are the decisions that employer is going to have to make within this platform?
Yeah, the employers, the good news is the employers, once they make those decisions, will be able to reduce the amount of administrative oversight that they have of their health plan and turn it over to the private exchanges, which is going to reduce the number of human resources employees that they need, and that gives them some of their savings. The decisions they have to make, though, is what kinds of plans they're going to put their employees into, and this is a very important question. I'm writing a blog about it now. And that is, do they want to go to a defined contribution approach so that they can make their costs more predictable and also share more of the cost increases of the future with their employees to generate more consumerism? That all sounds great, and it sounds like a no-brainer, except when you're in the employer's shoes, you might think that may create a competitive benefit disadvantage on the labor market against your competitors who may not do that. So a competitor may say, I'm going to keep my defined benefit program, and that may be appealing to the employees. So what does the employer do about that? They want the benefits of the defined contribution. They want their employees to share more of the cost, so that they have skin in the game and they're better consumers. But they don't want to create a benefit disadvantage. Right. And what they need to do about that is to take that extra money that they've saved and invest it into creating a culture of health and well-being on their campuses for their employees that will raise that morale and make them once again the employer of choice on the labor market.
I think to your point that's well stated, John. Specifically since we legitimately have a skilled worker shortage in this country, so I think it strategically is. Employers have to take a careful approach to which way they move in that competitive environment. But to that point, too, would you not agree that if all at once the competitors start to move that way, there's going to be this giant sucking sound of, them moving to this private exchange defined contribution model?
Yeah, I believe in tipping points, and I think we're at a tipping point already with the private exchange, just a year into it, really. And that's why I really do predict that 90 to 100% of large employers that are self-insured are going to be buying their health insurance from private exchanges in the next 5 years. So some of the surveys show anywhere from 36% to 70%. But surveys are based on what people think and say today. And if you follow the money and you think about the advantages and the value that the private exchange provides versus an individual carrier, then it doesn't take too much wisdom to figure out that almost everybody's going to be moving toward that higher value private exchange solution.
Yeah, and that, for our audience to hear this too, because we've heard from the exchange players themselves, and now we're hearing from you that is one of the leaders in the health promotion and on-site health management space, is that health management, health promotion is alive and well inside the exchange environment. It's an important programs for employers to put in place for productivity, for risk management, for skill retention. Agree?
That's right.
Yeah.
The private exchanges want to have health management going on inside the exchanges. And you think about if you have multiple carriers in your exchange, it makes it more difficult for the carriers to use their wellness tools. So the private exchanges are looking for other ways to accomplish this, and we think that Healthstat provides that solution.
Hey, John, we've got about a minute or so to go, and I really appreciate you having us on. Are you spending this time with us today? Sorry about that little breakup, but I want our audience to know that you'll be able to hear John in person if you can make the Las Vegas IHC Forum West. He'll be conducting a workshop there and participating in the event. But John, leave our audience take a minute or so and leave our audience with some takeaways, please.
Well, sure. So private exchanges can reduce the administrative costs of employer health benefits. That provides an opportunity for the employer to reinvest those savings into health promotion. And of course, health promotion reduces downstream healthcare costs and improves productivity, which, by the way, is more valuable than even reducing health costs. So it's a win-win for the employers. And it's a win-win for the employees because now they have more choice to use the defined contribution they're receiving from their employer toward the purchase of the right plan for them, not having their employer make that decision for them. And so as the private exchanges demand better results from health promotion programs, companies like Healthstat have firmly taken a lead in patient engagement and health behavior change as a way to partner with them to be able to accomplish this for those employers. We're excited about this prospect, and I think most employers already believe that health promotion can provide them with relief from their insurance costs, but many struggle to find economical ways to implement them, and we think the private exchange is that solution.
Well, John, we really appreciate having you on the program today. Have a great weekend up there in the Northwest, and look forward to seeing you at IHC Forum West. To the audience, again, the promo to access the private exchange database at privatehealthcareexchanges.com is IHC Radio, all caps, and you can get discounts on the subscription models there. John, again, thanks so much, and to the rest of our audience, we will talk to you next Friday on Healthcare Consumerism Radio.
Thank you, Brent and Doug, for having me.
Welcome back to Healthcare Consumerism Radio. This is Brent Macy, Managing Director for the Institute for Healthcare Consumerism, joined with CEO and founder of the Institute for Healthcare Consumerism, Doug Field. Great segment there with Jeff.
Yeah, it was.
It's very, very interesting what they're doing there at Connecture. They're looking at a lot of different pieces to the puzzle, and those type segments could go on for the full hour.
Yeah, with their PBM piece that they've had for quite some time, they've got and then their involvement in powering Medicare.gov. They have a very unique long arm of experience in exchange. You've got a lot of new evolving players, new players in space. They've been at it a long time.
Yeah, and I think it was an interesting point he made around the voluntary benefits piece. And we see that more and more when talking with the voluntary benefits piece. That's going to be an important, critical part to all these exchanges that we need to look at, or everybody needs to look at. So we'll see where all this moves. So actually, joining us on the program right now is Nancy Scola Lumbear, and she is the partner of Health and Benefits at Loris Strategies. Welcome to the program, Nancy.
Hello, and thank you.
Hey, Nancy, nice to have you. This is Doug Field. You've got a interesting bird's eye view of what's happening in this exchange market, and you've taken a unique position. Kind of give our audience a little background on Loris, and then let's talk specifically about what you're doing around exchanges.
Well, Loris Strategies is a human resources consulting firm, and I would call us more of a boutique firm. We're not huge. We're mid-sized. But within our health and benefits practice, we, over the past couple of years, have been looking at these private exchanges, and we actually did start thinking, well, we need to determine whether we want to have one of our own or not. But what tends to happen with us is that our main focus is the success of our clients. And we felt that if we did not keep our unbiased viewpoint on things, that we would not be able to be that trusted advisor for them. So that's really the rationale where we ended up where we are on this.
What's your target size company? What is typically, a client size?
Well, we have smaller-sized clients, and I'll say within the 200 employee range, but we go up to 40,000, 50,000 employees. Our target size is probably in the mid area, maybe 5,000 to 15,000.
Yeah, which are the companies that I think need the most help when it comes to understanding whether exchanges fit their employee population or not?
I think that's correct, yes.
Yeah. Where do you see the exchange market going from your seat?
Well, I see certainly it's a rapidly evolving, so it's a little hard to keep up with. But certainly I think that at least recently and at the beginning of all of this, all of the brokers' consultants were in a rush to figure out how they could get one. Mm-hmm. I think maybe that might be settling in a little bit, but now there's a lot of the brokers and consultants potentially buying up some of those independent companies that there used to be. And there's probably more of them coming on. I also see some of the things that are changing is that the private exchanges are not rushing, but trying to bolster and add to the services that they're providing for the employer or the customer. Mm-hmm. So they're saying that they want to offer more ongoing services, not just that beginning open enrollment and decision support kind of service, but potentially a concierge or an advocacy type of service to the employees of the employer on an ongoing year-round basis. They're also adding more products, so it's not just the medical care and dental and vision, but also some life insurance and disability, a lot of the voluntary products, auto home, even the pet insurance, which is popular with a lot of people. Yeah. And I think they're really trying to outdo themselves with the leveraging of technology. Getting the social media, the mobile apps. As many of those bells and whistles that they can use to appeal to a younger crowd.
Where do you see the health management piece?
The health management, I'll go back a little bit to the advocacy piece that I was talking about, and I think that there is an opportunity potentially to have an umbrella health advocacy and getting into some of the clinical aspects of that, but it's a real mixed bag right now. So I think for the most part it's still being left to the insurance carriers to handle that for their own plans.
Yeah. Now, Nancy, we had mentioned it on the News and Views, the first segment of the program today. There's a lot of different models out there. So from your seat, what type of private exchanges, could kind of give our audience what those models are and what's maybe best for a certain size employer.
Mm-hmm. Yeah, and you're right. There are a lot of models because I started, making a list of some of the different types of models, and I think I even surprised myself. But certainly one of the different types of models there are is ones that provide multiple carriers, insurance carriers programs, and ones that provide just a single carrier. So that is, an issue for, let's say you have a national company who has employees all across the country. A multi-carrier program might be the best solution for them because every carrier has some weak spots with regard to geography. So in order for them to get maybe best in class for each location of their employees, they may need to have more than one insurance carrier. Whereas maybe a smaller or a more, company that has locations only in one spot, it might just be easier to use a single carrier, and many times it's that carrier themselves that are providing the exchange. So that could be maybe easier administratively.
What do you see your employers that you either work with or employers that you're aware of doing as it relates to the mix of, some of my employers are going into a public exchange, some are going into a private exchange, or even if we don't have a private exchange, I'm still sending some of my employees to a public exchange. How do you see that all kind of shaken out?
I don't hear a lot about moving employees into a public exchange. So again, I'm working maybe with the mid to larger companies, and perhaps there's more of those discussions going on with the smaller companies. But with the larger companies, they are focused on they're actually focused on maintaining their own benefits program, whether it's in or out of a private exchange. But they're all just kind of looking at, when they might be able to move into a private exchange, whether or not that's a exit strategy for them eventually or not. They haven't made those decisions. But I think most of the larger employers certainly have been giving all of their employees information about the public exchanges, partly because they're required to, and hoping that maybe some of the COBRA participants will move off COBRA and onto the public exchange. But for the most part, the benefits eligible employees, they're not. I don't think they know what employees' interest is in the public exchanges.
Yeah, I think that's right. I mean, I've heard some of it. We see and hear a lot from the employers we touch that, there's certainly a high majority of employers that, have indicated they're going to look at exchanges. But we see a good percent of employers that are taking, I don't want to say advantage, but taking this opportunity to accelerate their employee population to full replacement, HSA high deductible plans, surrounded by all the different tools and services, and not go to exchange, but accelerate the, their, the full replacement programs. Do you see some of the same?
I don't. I see a little bit of full replacement, but certainly I think that employers are, as you say, taking advantage of some of this kind of market upheaval, if you will, to start making, larger changes in their programs than they have over the past couple of years. I think over the past couple of years there's been a little bit of pausing, if you will, and freezing of, we don't know what's going to happen with healthcare reform, so we're not going to make any big changes because it might take us in the wrong direction. And now they're starting to think differently about that. And start to make some changes that, some employers want to blame it on ACA. Some employers are, trying to make it look as if, this is what we're trying to do for you. I mean, It's just different spins. But I think you're right. There's bigger changes happening now than there have been.
Yeah, we see that.
Nancy, Doug and I were at a meeting here in Atlanta, a Web Atlanta meeting, and there was a panel of exchanges. I believe it was Aon, Gallagher, Mercer, Buck Consultants, and then it was moderated by Benefit Focus. But one of the things that they had mentioned is they're seeing a lot of employee consumers when they get into these exchanges that they're buying down from a benefit standpoint. From a cost standpoint, are these exchanges effective for the employers that you're working with? And also, what are some of the things that most people really don't realize about an exchange?
Okay. Well, from the cost savings standpoint, I think, you're right that there is, whether it be through a defined contribution strategy where, employees definitely have a fixed bucket of money that they can spend, that might cause them or incentivize them to buy down to a less rich plan than they may have had before. And then also, throughout that whole process, and I would say that is, yes, they're buying the right plan for them, hopefully, but it's also in essence a cost shift to the employee based on what they had before. But that is a cost savings nonetheless to the employer. I think what the jury is still out on is whether the private exchanges are going to help or a sustainable lower cost trend for the underlying healthcare, the cost of healthcare. So that's kind of where we're still waiting to see how that's going to happen and what they're doing to cause that to happen.
Yeah, I think there's an element of controlling costs through defined contribution, but does it really control healthcare costs? I think you're exactly correct.
Right.
We've got about a minute to go, and I want to give you an opportunity to kind of wrap this up and leave our audience with a couple takeaways. Sure.
I would say, and you had mentioned too, what are some of the things that kind of people don't realize or might be a surprise to them? And what we're surprised about is that there are, there's a certain high-level executive that isn't quite sure the difference between a public and a private exchange. So I would start the education with the executive sooner rather than later if they haven't already. I think that once you get into this is very complex, and you, the employer, really need to know what your goals and objectives are, what you're trying to accomplish through all of this. and the lead time that it requires in order to make the decision first, whether this makes sense for you and your HR strategy, or once you do that, or if you do that, then which model is the best for you.
Yep. Well, Nancy, listen, we really enjoyed having you on the program, and come down and join us in May at our IHC Forum. We'd love to have you come down with us.
Well, thank you very much.
And you have a great weekend. And
thank you.
To our audience, stay tuned for the next segment of Healthcare Consumerism Radio.